I'm Monica Krause. I was born and raised here in Omaha, Nebraska, and did my undergraduate training at the University of Nebraska in Lincoln before coming here to UNMC to do my medical school and my internship. And after that, I had the opportunity to go up to Rochester, Minnesota to Mayo Clinic to study neurology and neurocritical care. And now I have the wonderful opportunity to come back and work at Nebraska Medicine and UNMC as a neurohospitalist and neurointensivist. From an early age, my grandparents had some pretty serious medical conditions that required them to be hospitalized, and that was one of my first exposures to both medicine as well as hospital health care. I could see the impact that those physicians had on my grandparents' quality of life. And it was something that I realized I wanted to be able to give back to others. And so that's really what drew me into the field of medicine in general. And being able to get together with patients and families and help them understand the disorders that they're going through, it really gives me a lot of excitement and motivates me every day to come in and work with them. I'm a neurologist by training as well as a neurointensivist, which means that I take care of patients who have neurologic disorders in an ICU. Neurology is a lot like a jigsaw puzzle, and you have to take the history that you get as well as the physical examination and piece it together. And I've always enjoyed putting together jigsaw puzzles since I was a little girl. So being able to do that as a career is something that I've really enjoyed, and neurology lets me do that. And it lets me also to enjoy my passion of being able to stay in the hospital and work with patients who are in very acute critical conditions that require them to be in an ICU. I see patients with a variety of different processes that affect their brain. So for instance, bad bleeds in their brain could be from a subarachnoid hemorrhage or something else, or if they've had a stroke, that's another reason that I would see them. Some other things that I see are general seizure disorders, as well as patients who have respiratory problems because of an interaction between their nerve and their muscles. And that's kind of the bread and butter of the ICU. And then in the hospital side, really can see a variety of things. Seizure disorders is very common, and strokes are also very common. I went to school here. I knew it was Nebraska Medicine and UNMC were wonderful places to work and to train and to be able to educate people. I do have a strong passion to teach, to work with medical students and residents. So being able to do that is something that brought me back. The other thing, I knew that the people in the neurology department were wonderful colleagues and really cared about patients, cared about each other. And so being able to do all of those things together and be in an environment like that, it was not even a question of wanting to be able to come back and work at this institution.